Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Jinguan Yang. He's a psychiatrist and integrative medicine physician. Today's KevinMD article is titled The Connection Between Organ Systems and Skin Health in Chinese Medicine. Jinguan, welcome to the show.
Thank you for inviting me, Kevin.
So we'll talk about your article in a little bit. Just first off, briefly share your story and journey.
Well, I was born in China, a small city, a capital city of Hefei, Anhui province. And when I was 13 years old, my father started persuade me to learn Chinese medicine with him because he was afraid that I was going to be sent to the countryside to be re-educated by the farmers during Cultural Revolution when I wouldn't have enough food and I will starve to death. And so if I can learn Chinese medicine and become barefoot doctor, meaning carry boxes of needles, herbs to help the farmers when they got sick, I might be able to survive it. So anyway, that's how I began to learn the family tradition when I was very young. And that's been Chinese medicine. Acupuncture has been my family tradition for generations.
So whenever we hear about Chinese medicine, it can mean so many different things. Now, for those who aren't familiar with what you do, how do you define what Chinese medicine is?
Chinese medicine, I like to say number one, it is a medicine that we inherited from maybe previous civilizations. I don't know how, because the understanding of human energetics and to describe it in a very visual, concrete way require technology that we don't have today. So I believe it was creation of a previous civilization where they have far more advanced technology that can actually visualize energetic aspects of our human body. So that leads to the second definition of Chinese medicine is a medicine for human energetics. Even though it recognizes our bones, our muscles, the structure, it recognizes our bodies by chemistry to a certain degree, but they don't care because when they see the human energies, which is foundation of our life and function, they don't care about anything else. They only focus on how we can fix the energetic problems, you know. So through food, through lifestyle, and through herbal remedies, through acupuncture. So that's the second feature of that. The third feature of that, it is a holistic medicine. Because when you see the energetic connection of the human body, you begin to see the connection we don't see anymore with our current technology. For example, we began to see how the energetic channels centered in the organ system but reach far away to the superficial part of the body, like the liver connect with your nails, kidney connect with your hair, lung connect your skin. So through energetic system, the concept of holistic medicine is not a concept, is a reality. And that's the third features of it. The fourth feature of it, it is real mind-body medicine because at the energetic level, your emotion, your mental function, your physical function are in the same place. So what drives our heartbeat is also what drives our consciousness. What drives our vision, also what drives our executive function, and so on and so forth. So that's real mind-body medicine, except they cannot be separated. So that's one thing. Another feature of it, it is a real natural medicine because not only emphasize everything we do is related to our environment. We're constantly exchange our energy with the energy in our environment. So we're really part of the overall energetic universe that we're part of it. And inside us, we have everything that nature has. So in a way, our body is a small universe itself. and it follows the same law of the universe that regulates the universe. The same law that regulates universe also regulates our body functions. So therefore, we're really part of the nature, and nature is a part of us. I think that will really kind of, if you want to use modern medicine, it's also lifestyle medicine because it emphasizes so much about how, what do we eat, what do we think, what do we do, have everything to do with our health. And most importantly, they emphasize the primary cause of health issues is emotional distress and stress. So modern medicine is really catching up to what the Chinese medicine has already recognized. Again, I can't take the credit. I don't think the Chinese should take credit for it because it's not creation of the Chinese in the last 1,000 years, 3,000 years, even 10,000 years. We really inherited it from a civilization where they really had ability to visualize understanding and the human energetics.
Your KevinMD article is titled The Connection Between Organ Systems and Skin Health in Chinese Medicine. So tell us some of the common conditions that you see in your clinic that can be approached with Chinese medicine.
Well, first, yes, number one, pain. Everybody recognizes how acupuncture can be effective for treating pain, not just chronic pain, but also acute pain. I'll give you two stories. One story is a police officer who is a 6 feet over 250 pounds big guy. And one day he was like in his 30s, and he had bad sneezing. That's what he said. Suddenly, he had sharp pain in his lower back to the point he couldn't stand up. So he was taken to the emergency room. They did everything, gave him muscle relaxants, painkillers, and he still couldn't move. And he was bedridden. His wife was my patient, and he always accompanied his wife to see me. That day he was absent, so I was asking about where was he, and she told me what happened. I said, if you could bring him to my office, I will see what I can do for him. So they brought him to my office and in the wheelchair, and I put 2 needles on the hands where there was points that's connected with lower back. Again, we were just told that was the points to use for lower back pain. And nobody could explain why, but I just tried it, okay? So I stimulate those 2 points, and he was able to stand up right away and walk. So we did a few more treatments for a couple of weeks, and that was it. So that's for the acute pain. The second patients are someone actually was the former boss, my wife, and he was very active, 70-some years old, successful businessman who goes to New York, visit his clients, and suddenly he developed, not suddenly, gradually he developed the chronic lower back pain or sciatic pain shooting down to his legs. And he had to stop every block to sit down, and because that's how much pain he was enduring. He was a stubborn guy. He didn't want to take painkillers because he said that was numb his mind. He couldn't focus on talking to his clients. Anyway, so after 4 months, and again, he is not in the way innocent in terms of health. He had prostate cancer, and he had a spinal stenosis. He has some metastatic cancer issues. And his friend was a famous orthopedic surgeon and say, maybe we could operate. And he didn't want that because his friend's wife wouldn't let her husband touch my patient's back. Anyway, So he was in my office after 4 months, nothing helped, and crying and describing uh, how challenging it was. And I began to treat him. And when I was taking the history, I treated him with acupuncture. I also did a technique called the neuroemotional technique, which basically desensitized him from past trauma. But anyway, so after 2 or 3 weeks of treatment, he was significantly better. Mm. And one day he was asking me, is it possible your acupuncture make me less agitated or angry or make my mood better? I said, look, your pain is along the gallbladder and liver energy channels, and that gallbladder liver regulates your mood, particularly anger. I said, I cannot imagine I can get rid of the pain along your liver gallbladder channels without helping your frustration, your anger, your your disappointment, whatever that emotion is. Anyway, so that's a two story shows how acupuncture helps pain. On the same token, every organ system energetically regulates different type of mood. Fear, the kidney for the fear, and the lung for the sadness, and liver for the anger, and the heart for the vulnerabilities and confusion, and the spleen for the worries. So when those emotional problems come to me, and that's we help them the best. We call normally people say I'm stressed. Stress really is a combination of all those emotions in response to what's going on in their life. And the third things we help the most is digestive problems, reflux, stomach pains, gas, constipation, diarrhea, IBS. And those conditions actually have a lot to do with emotional distress, energetic problems. Because if you check them, you don't see anything wrong. It's just energetically problematic. And that we see a lot. In other words, I would like to say almost anything, everything that cause energetic imbalance in human body, that is going to respond really well with acupuncture. If you, as your internist, if you're primary care, almost majority of your patients come to you, what they complain is energetic problem. I'm cold, I'm having a fever, I'm tired, I'm having pain, or I can't sleep, I'm depressed, I'm constipated, I'm have reflux, I'm nausea, I'm coughing. All those symptoms is energetic problems and by nature. And a lot of time we do all kinds of tests. We're trying to look for chemical abnormalities. We can't find them. We're trying to find structural problems most likely, and we can't find them, or we find some abnormal structure problem, abnormality in structure, actually not necessarily the reason that caused the pain, like lower back. We now know there's a very poor correlation what we see on X-ray, MRI for lower back between that and the lower back pain. So anyway, so those are the conditions we commonly help people with acupuncture. And you probably heard infertility is another issue that acupuncture can be very helpful. Even just 1 or 2 treatments can improve the IVF success from 28% to 45%.
If I had a patient who was interested in Chinese medicine, or if I wanted to refer a patient to a Chinese medicine practitioner, what kind of qualifications should they be looking out for? What are some of the certifications should I be looking out for to know that this is a reputable practitioner?
I wrote an article called How to Find a Good Acupuncturist. In the United States, you have 3 kinds of people practicing acupuncture. And even one is licensed acupuncturist who were trained in the United States in one of the accredited master degree program, and they have a over 2,000 hour credits, and if they study herbal medicine, even another 500 or 1,000 hours. And then they have to pass national examinations, then get licensed. So that's one kind of acupuncturist you're going to be seeing in most of the clinics. The second kind is people who already graduate from the Chinese medicine school or medical school. They have enough credits already. They come to the United States, they take the national exams, and then they're licensed to practice. And the third is medical doctors who are licensed physicians. They take 300 continuing medical education courses, and they are licensed to practice acupuncture, only 300 hours. And there's a number of programs in the country, but the majority of people who took those courses, end up not feeling comfortable or not finding places to practice it, but they got education on that. So whoever they are, when you go to see an acupuncturist, in my opinion, you're not going to see a technician. You're not going to see someone just know how to insert needles on your body. Superficially, they all do the same thing. But the key issue is, first of all, they have to care, how care they are about your condition. Number two, do they understand Chinese medicine as a medical system and acupuncture as a treatment modality? Or they only know how to do the acupuncture as a treatment modality without knowing the entire medicine. How do you tell? You tell by what questions they're asking. Do they looking at your tongue? Do they take your pulses? Do they tell you what your energetic imbalance is like? If you're hearing them talking like giving a weather broadcast, and then you say that might be the right, because weather is energy. So if they say, well, you have a spleen dampness, or you have a dryness in the lung, or you have liver heat, that sounds right. That means they're doing the energetic analysis on you. They combine what organ system is involved, what type of energetic imbalance, and then they understand the medicine. If they say, okay, well, why do you treat me this way? I'm treating your sciatics, I'm treating your depression, I'm treating your anxiety, or I'm treating your IBS. The Chinese medicine doesn't have this concept. We don't treat those diagnoses. We treat energetic imbalance, whatever their cause. For example, people have a liver qi stagnation can manifest as migraine headaches, as a depression, as insomnia, as IBS, as fibromyalgia. Okay, so they're same energetic imbalance, but can manifest in the different diagnosis or different symptoms among different people. So that's what you want to look for. You want to see they really take time, ask the question, give you the diagnosis, then they give you a strategy and a plan to say, okay, this is what we have to do with acupuncture. This is what we have to do with herbs. This is how long it might take so that we can see some results. In the meantime, you need to make some changes in your diet in this way, in your sleep in other way, in your sex in other way. That's all kind of lifestyle consultations that come with it. That is what you should look for.
We're talking to Jinguan Yang. He's a psychiatrist and integrative medicine physician. Today's KevinMD article is The Connection Between Organ Systems and Skin Health in Chinese Medicine. So let's end off with some of your take-home messages that you'll like to leave with the KevinMD audience.
Well, since the article was talking about skin conditions and the organ system, so I think I should really describe those connections. In Chinese medicine, energetically, and each organ system support a part of our skin. Okay, so if we look at It's not skin or appearance. For example, our hair is nourished by the energy and essence of our kidney, and our skin is nourished by the energy from the lungs, and our muscles is nourished by the energy of spleen, and our vessels, complexion, is supported by our heart, and the bone is supported by the kidney again. So if we are looking at, and our nails is the liver, and so this something we care about the beauty on the outside, and has everything to do with how healthy we are inside, energetically and nutritionally as well. So that's where the acupuncture as an energetic therapy for beauty, health, and happiness is a very important addition.
Well, thank you so much for sharing your time, perspective, and insight. And thanks again for coming on the show.
Thank you, Kevin.